We have brand new markers. Oh, they're from Daiso. Cool. I'm excited. And today we're working on indications, contraindications. Whoa, loud. Woo. I still haven't thrown the bucket yet this time, guys.
Well, we anticipate that.
We have plenty of time.
Really excited.
Yeah. Let's see. You guys are like protectively securing the bucket. Okay. Make sure that we're getting the board. I keep cutting out the board, I guess. Okay. I think that works.
Gonna write in the book. I forgot my journal.
All right. Well, there you go. Paper.
I feel like I'm gonna lose it. It's okay. I can write in the book. I'm not giving this book back.
True.
It's mine.
True.
I'll remember it forever.
All right. Let's really quick just sweep through our bones here. Where are you guys feeling you are at for memorizing just the skeleton structure so far?
Oh, like the names of the bones?
Uh-huh.
I think I know all of them.
Pretty settled in? Yeah?
Everybody knows them.
I think I probably know the same number that I did when I got here.
Okay. All right. Well, let's play around with it just a little bit. Let's see a humerus.
Humorous. That's in funny bone.
Upper arm.
The upper
Yep,
arm, okay.
yep. So we got the head of the humerus down into the elbow, humerus. Okay. Let's have a femur. Yes. Nice. Okay, tibia.
Tibia is down here. It's the little one, right?
It's going to be the front
Front.
corner there. Yep. Let's have some distal phalanges. This last outer edge on those fingers. Nice. How about scapula? Nice. Clavicles. Yep. Tarsals.
It's down here.
Yep, that's right. Where are they?
Well, let's see. Are they the big long bones that connect your toes?
Those will be the metatarsals.
Oh, okay, so the tarsals.
So the tarsals are the little kind of more cuboid or square-ish bones that are closer into the ankle,
Oh.
right in the foot there. So we've got the map up on the wall if you want to take a little glimpse on that, and just while you're feeling, give yourself some of that. And then you're gonna be able to grab in the foot while we're here, the calcaneus, kind of right into the heel, and the talus just kind of above and behind it. Calcaneus and talus. Yeah. All right. And so there's those tarsals were the cuboid bones. So the upper foot, metatarsals are those longer bones reaching out towards the phalanges. Okay. How about fibula?
Other leg bone.
Mm-hmm.
Smaller.
So if that one, if the tibia is in the front, then the fibia is
Yeah,
back.
the fibula running right up that edge. Yep. Let's have a radius.
That's in the arm.
That's right. In the arm.
Which one of these two?
Which one?
I want to guess this one.
Yes. Pulling off the
Along the
thumb.
Yeah.
That's right. And so the other one is ulna. Exactly. Okay. Let's have a cervical spine. Vertebrae of the cervical spine.
Up here.
That's right. Up here in the neck. Lumbar spine.
That's down here.
Mm-hmm. You've got lots of ribs. Where's rib number 1? We're getting pretty close. Eva's right up against the manubrium right
So,
here.
Is this a rib right here?
Yes, it is. Exactly. So rib number 1 is actually dropping right into the base of the neck, basically, if you access it from there. Rib number 1. And bottom ribs will be rib number 12. Rib number 12. 12 ribs. And that's the same as 12 vertebrae of the mid back. What's that called? We already did lumbar. Thoracic, yes. Okay. Cranium. Nice. Mandible. Beautiful. Right in there. Carpals.
That's going to be in your wrist, right?
Yeah, in the hand, but at the wrist. So the wrist itself is those two bones intersecting where we have the radius and the ulna, but they're attaching into that little set of more of those cuboid bones, carpals. Yep. And that puts the metacarpals where?
That would be in the hand?
Yeah, in the hand, kind of ascending away from the carpals at the upper palm near the wrist, those longer bones running into the phalanges. It's proximal, medial, distal, distal phalanges. Clavicles. Nice. Right in there. Sternum.
That's this one right here.
Right. The breastbone. And there's kind of two components of there. That's the sternum proper, and then it's got a little bit of a almost not quite octagonal or hexagonal manubrium, which is a plate of the sternum. They're basically attached, but you can kind of discern a little bit of movement there on those joints. Okay, we cruise through patella.
That would be, your knee bone.
Kneecap. Perfect, yeah. And of course we've got the pelvis. Okay, yeah. Let's go through the pelvis a little bit. We didn't unpack that super intensively before, but would you guys be able to find the ilium of the pelvis at this point?
That's this side.
Yeah, that's up the ridges of the upper pelvis. So we have the iliac crest.
Is this it?
If you jump in there, that's right. Yeah, on our little skeleton guy over there. So this upper kind of formation on the pelvis. And feel her on your own while you're in there. Really kind of grab that, get a handle. So we've got that posterior iliac and anterior iliac crest. You can dive down inside it. You give your abdomen a little bit of a rock. You'll open up one side versus the other so you can feel how much access you can get to the interior of the iliac crest. Yeah. And then the pubis is going to be the bone coming across the front of the pelvis. You can get into that and kind of access that. It comes together, the pubic symphysis is the two sides, and they're going to align and have a little bit of flex and play between the 2 points of contact there. And then the ischium. Yeah, and that's going to be more the sit bone. So we're going to grab all the way, if you can actually get to that ischial tuberosity. Yeah. And that's where a lot of the hamstrings are attaching. So when you get those hamstrings kind of gathering in to that bone right there, and then they're going to descend down in and kind of crisscross over the knee on the inside. Okay, you guys are in pretty good shape. Keep working on bones. We definitely need to have those locked down tight, and we'll keep playing with that, and also the muscle groups. Okay, so now you're a little bit tuned in. You've cognitively entered your somatic network. and we're jumping down into the body. Let's go ahead and take a few moments to just arrive even deeper into the body, settle into some stillness. Take some deep breaths. And let your mind play through as we get those waves of sensation, attunement, just focusing your attention and awareness into the soles of your feet, tops of your feet, ankles, shins, knees, thighs and hips, sweeping up the abdomen and the spine, into the chest and shoulders. That meditative state is not a hold still competition. Don't be afraid to wiggle around to activate that body scanning awareness a little bit as you're arriving here. And sweep up through the cervical spine, into the cranium, down over the top of the head, into the face, descending over the mandible, back down the throat. Ride that awareness out to the edges of the clavicle. And slowly work your way distal down the humerus, into the elbow, into the forearm. Trace the radius, trace the ulna with your awareness. And jump the wrists into the carpals. Follow the metacarpals. Add into the phalanges and finish at the tips of the fingers. Okay? And grab that again from the bottom of the feet with this deep breath. Let's get a little more coordinated with the breath this time through. Sweeping up, and let your own mind play through the terms that you've already grabbed on the skeleton here. Just easily. We don't need to get ourselves into tight cognitive focus. We're in somatic focus now, and allowing all of those terms to associate deeply into the body. This is how we write the body as the book, because we're not always going to be able to pull out a book in the middle of a treatment or the middle of an exam or what have you. But if you can deeply write your anatomical, physiological knowledge into your own body, it will always be with you. Let those breaths keep sweeping through. Out into the distal phalanges. Yeah. And one final breath, sweeping all the way up and dropping back down, arriving back at the surface of your skin and rejoining us in the room. All right. Good job, everybody. Okay. So today we have a little bit of wrapping up to do with our indications, contraindications, content. So let's jump straight into our ideas of indications. What is an indication?
Someone comes in, they want a massage, and they talk about their bodies and their symptoms or whatever, and they're going through, and it looks like we're good to go with giving them the massage. So I think an indication is that whatever's going on with them means that they should receive.
Yes. The indication is the thing that is happening that provokes their need or desire for a massage. So indication could be relaxation. It could be...
New pen?
It is new pen. It's kind of little though. Can you guys read it?
Only because we know what you just wrote.
Right? Okay. It's very small. I'll switch to the blue.
You're so excited
Such
about
a-
these pens.
I know, I'm gonna do like elaborate drawings with them, but I'll have to get here ahead of time so I can make them thick. Okay, so our indications, relaxation, what else?
Muscle soreness.
Yeah. Soreness. Sore or ache. Structural problems. So basically, this is our whole class of sensations, which we went kind of deep into the whole concept of sensations in our last class, all these different ways of describing what we can pick up with our sensory system, our nervous system. So the sensations that are ultimately going to cause and provoke somebody to schedule a massage are indications. You could extrapolate that out and say, like, a person is being recommended by an outside provider to address anxiety or pain. But ultimately, it starts in the client's body, right? And that's kind of our special lens that we get to carry as body workers, is that it's always starting inside the client's body. That's where the actual information is, even if other care providers are involved in that team. Okay, so contraindications are going to be the set of sensations in the client's body initially, but also possibly objective information. So subjective was the client's own experience. Objective information is what we can see about the client from the outside. Yeah. Okay, so objective or subjective events or observations that are happening in the client's body that are telling us that massage, or the massage that we would automatically come in to apply, maybe not in the client's best interest at this point. Objective and subjective. Contraindications. Okay. So what are the contraindications that you are already aware of?
If somebody
Let's trace
has
through
a
those.
bad sunburn.
Bad sunburn, absolutely. If the skin is already in kind of critical repair, then we don't need to be mushing on those cells and giving them more work, putting them through more restorative effort.
Which would happen, I guess, a lot here, like people coming in and getting sunburned on their vacation. And
Yeah.
oh, it's Hawaii. I can do everything. Get sunburned, go get a massage. Someone comes in totally drunk.
Absolutely, totally drunk. Why is totally drunk not a good
They can't
position for a client to
They
be in?
can't consent. Right? They aren't going to be able to communicate their what is too much, too little. They can't really
Right.
communicate and be connected with their bodies.
Exactly. Their feedback has become unreliable, and so we can't expect them to help us modulate what their best experience would be if they've been drinking heavily. Really, at all, you're going to have some impact on that. And some people would say, like, if somebody is drink anything, you should not touch them. It's a kind of professional discretion point, honestly, where, like, if you're working in a spa at a hotel and people are coming in from having some champagne with dinner, like, there's not a rule about this. It's not a law that you can't touch anybody who has any alcohol on board. But absolutely, if you're getting that sense of interruption to their discernment of their own somatic experience, that's a big caution. Yeah. What else do we have? We've got sun, We've got alcohol consumption. These are kind of temporary.
Any drugs that are going to be inhibiting their
Yes.
judgment or
Judgment, perception, concerns from any substances. Yeah.
The one I've come across the most is diabetes, and if they're taking insulin and their blood pressure is alongside the insulin dosage, you have to like space out when you give them the massage.
Right.
I can't remember if it's like you have to do it after they've taken. I don't know the actual rule. Because if their blood pressure is high naturally, and they take insulin, then that would lower it, so you don't want to bring it back up.
So in an ideal world, people who are using massage therapy to treat diabetes are working with a lymphatic specialist. And so that's a whole other like set of certification that you absolutely can work towards. But the big picture on diabetes, and this is also important playing into when we're treating people who have been treated for cancer, is that lymphatic system set of concerns that we're going to have a pretty significant impact on the flow of the lymphatic system and the rate of drainage. And so for people whose lymphatic systems are challenged or not operating smoothly, there are a handful of considerations that you definitely want to keep in mind. Yeah. Okay. That's a good little bit bigger, broader scope one. We've got the alcohol and the sun are both kind of transient conditions. Diabetes is a longer term thing that you'd be potentially treating that person with ongoingly.
What about paralysis? What if they have a bad arm or a leg or two legs that are they don't have sensation?
Right.
Would you be able to massage somebody like that?
So this gets us into the really important breakdown on what is going on with contraindications. So we have 3 different groupings of contraindications, okay? So that's going to be regional contraindications. This is situations that are happening somewhere on the body that makes it challenging or more specific or unadvisable to treat that specific area. So maybe the sunburn is only on the big area of the back, or maybe there's a rash or kind of like a regional situation, maybe a bruise, injury of some kind, where getting in there at that time is a bit ill-advised. General contraindications are going to be like systemic, where it's just not a good time to try to do body work proper, to address any kind of structural issues, to change the lay of the muscular landscape, etc. And so those will be situations like active infection, flu, anything that is contagious. And kind of significant systemic health status issues. Any mental health concerns that are limiting their ability to give consent, or to be aware of what's going on and give you appropriate feedback in case of a need for a change. Yeah. Okay. Absolute contraindications are a very small category. I want to make sure that I hit them all. Have you guys checked out the appendix in your book at all?
The appendix of the book? Or
Of the book.
appendix of the
Yes,
book?
the appendix of the book.
No, not yet.
Okay. There are some really helpful
Ooh,
big lists back here.
where's notes?
Okay. Appendix A is going to have our indications, contraindications. Okay. So our absolute contraindications oh, this is interesting. It does have the whole, okay. On 761, we're not going to work on anybody going through pneumonia, acute general pneumonia, advanced. Okay. We're not going to work on anybody going through kidney failure, respiratory failure, diabetes with complications. That would be like gangrene, heart, kidney disease, high or unstable blood pressure. We're not going to work on eclampsia or toxemia in pregnancy. We're not going to work on hemophilia, which is going to look like kind of a very extreme anemia. They're not going to show up not knowing that they have that condition. So you don't have to be prepared to recognize that per se. But you didn't need to be able to recognize that it is a contraindication. Hemorrhage. Obviously, if somebody is actively outright bleeding at the time of massage, you are not massaging them. That's just not the priority on their wellness goals. Liver failure. If they have seen a physician and kind of stabilized, they may be able to get some benefits from working with a massage therapist more focused on like relaxation, recovery support, but you're not going to go in and try to adjust their lymphatic system or their blood flow. Post-cerebrovascular accident, we're not working on strokes or traumatic brain injuries or unstabilized conditions. That to say, like, that's in the window of immediate recovery of the stroke. You will work on people that had a stroke at some point in their past and their body is now stabilized. There are effects, but they're not actively and ongoingly suffering from that, okay? Severe atherosclerosis, severe hypertension, shock, significant fever, acute conditions. Obviously, anything that requires first aid or immediate medical attention, you're not the one. We're not the ones to jump in on, say, anaphylaxis, appendicitis, CVA, diabetic coma, insulin shock, epileptic seizure, myocardial infarction, well, get that out, pneumothorax, atelectasis, severe asthma attack, syncope, that's fainting. Don't jump down and try to massage somebody who just fainted. Systemic contagion or infection. Okay, so are any of those situations where you could imagine seeing somebody going through those problems, or they're identifying to you like, I'm having a heart attack, or like, I have pneumonia that is acute right now, and you would instinctively be like, well, let's get you on the table. Right, exactly. This is very common sense precautions on the general, our general contraindications. So
there's a good Red Cross app though that like for first aid for
yes,
immediate responding if you
first
want to do
aid.
something.
Exactly. And like, you guys will have basic first aid, but obviously like your best results are going to come from quickly stabilize the situation and get assistance that is more appropriate to the scope of emergent conditions, because we are not emergent practitioners. Right. All right. Cool. So then getting into those local contraindications. You can kind of cruise through that list. It's much longer, and it, again, is very sensible. It's if we're looking at tissue that is already destabilized, and we know that we have an impact on the circulation of blood and the uptake of lymphatic fluid, then you're going to expect any kind of level of pressure to impact that tissue, and you're not going to want to get in the way of the body's own healing process in those situations. So those temporary or local conditions we'll call regional contraindications. And so those are the groupings: regional contraindications, general contraindications, absolute contraindications. That is worth spending a little bit of time with that list. Some of the exam questions will potentially ask you to kind of sort conditions into whether they're regional or general or absolute. So let that drop in, but I expect that you guys will be able to use common sense to extrapolate what needs to come to the front of your mind in those situations. Okay. Questions there?
There was a scenario we went over a little while ago briefly about someone coming in and you would, after a while, having them as a regular client, maybe suggest that they go see like a therapist or like go to some kind of psychiatric
Yes.
care. Thinking about like regulars I would have dropped at the bars I worked at that I couldn't because I'm not in control of that.
Right, you can't give a referral from bartending.
Go to my brother's bar. It's
right.
That worked once, but in that scenario, say you do recommend them to a place, and over the course of, this is a very specific situation, but they don't go and they keep coming back to you and you still feel a level of concern, like what
concern
how
for your own safety?
Concern for, maybe for, I don't know what it would evolve into, but more so for them, like, and I guess your own mental safety too at that point, because you're like worried about this person. Would the power just be to like drop them as a client, or?
Yes.
Yeah.
Yeah. So you are possibly employed by a larger business. You're quite possibly working for yourself. You have the same rights as a service provider as any other business. You can just decline to treat or to serve any person for any reason. And you don't have to say the reason. I would not recommend that you say the reason if you're dropping that door hard. It's just, no thank you. But in the situation that you're describing where you have somebody that you are concerned about, you don't mind continuing to work with them, but you need them to add somebody else into their care team, like honestly what I think you will usually find is that as you express the need that is otherwise going unspoken in their life, they will become kind of polarized on that issue. So if they're in basically a state of resistance, they're refusing to consider their need for more specific mental health treatment, their interest in seeing you will wane, and you will see them less and less. So these situations will often, unfortunately, sort themselves out without you having to do anything all that assertive or extreme. On the flip side, if they are showing interest in getting a more specific mental health treatment, you are a really great resource for them on the process of shopping for a therapist or looking for a counselor, which is super intimidating for a lot of people. But you're a person that's in that position to kind of have a read on what their day-to-day experience is already and be a pretty good sounding board for them of like, how did that feel when you saw that person? You don't need them to run down what did you talk about in your therapy session, but that if they're coming out of a therapy session with a sense of tension of like, did that go well? Is this a good fit for me or whatever? Like from the somatic angle, you can allow them to describe their own experience and kind of talk themselves in or out of the relationships that are forming on that therapeutic level. This is a good question.
Thank you.
Yeah, totally. Okay, so before we move on from indications, contraindications, I want to talk a little bit about the capacity and the sense of internal clarity kind of offered with your option of energy work. And depending on your past experiences, your other training, and your sense of baseline comfort approaching that way, that may be something that you can offer even to people who are in general or absolute indication, contraindication states. There are not really any conditions that create an absolute contraindication to soft holding. And the amount of psychological and physiological benefit that comes from literally just holding a limb or placing your hands around somebody and being in contact, touching them, which we have a special privilege for as body workers, is actually quite high. And if it's not working for them or it's not comfortable for them, they can tell you that and you can stop. So if they are interested in receiving bodywork type support in any way, and the conditions are more or less safe, they're not in an emergent situation or a contagious situation, the rest of these contraindications, you can potentially offer some help and support. So it's not necessarily you have to leave now, I can't help you at all. It can fall well within being able to maintain that therapeutic relationship and still promote some health benefit, the permission to slow down and experience their own body and just simply have that held space can be quite profound. So it's worth offering that if that's something that you're comfortable doing. If you see yourself as really more a clinical structural practitioner and you don't want to put yourself out there as an energy worker, also totally fine. Just don't do that. And this is, again, one of these beautiful privileges that we have as body workers, to find inside of ourselves what we are most comfortable and effective with in our offerings, and to put that forward as we see appropriate as we build our professional intuition and experience. Okay? All right. Sweet. We've got a little more time in this section. We do want to cover health, hygiene, sanitation, and safety today. This is going to be easy. Well, let's start with hygiene. So hygiene for professional body workers. These are the really big considerations that we need to think of. Basically, you're in a small space. You're in a closed area generally. You might be on a lanai or a screened in kind of porch. That's always nice. But anything that smells on your body for any reason, that person is going to be experiencing pretty extendedly. So we are very cautious about our general hygiene and the smells that we put on us deliberately and the smells that we pick up in our day-to-day life. Some people are extremely sensitive to smells, and even if they're not all that sensitive, being stuck in a closed room with somebody is an experience. So we're going to be conscientious about that. So generally, I'm going to go ahead and recommend that any day that you are working on clients, you start the day with a shower. We just always exfoliate and cleanse, and special attention is given to anywhere that we are tending to discharge more. Armpits, genitals, mouth. These are not difficult for you guys, so I just have to say it now. So that's the rules. You have to have this segment in your training. But I consider you all basically experts in this. You do want your hair to be clean. We always address nails. Nails are a concern. There was a window where people had kind of a belief that like chipped polish was a specific sanitation issue. Turns out it's not. We're not really worried about chipped polish per se. If you're washing your hands thoroughly and regularly at the recommended points, your color doesn't have to be perfect. However, the length of your nails is really important, and especially when you consider the texture of your hands, any snagging edges of your nails actually can be extremely distracting and agitating to clients. So short nails with smooth tips are really important. Yes, you absolutely can paint your nails. Mine are raggy right now, so I've been a little bit disrupted, but I love to go to the salon and have somebody else take care of my hands, because my hands take care of me, and I like to keep a pretty polish on because it can be kind of inspiring.
They always call me baby.
Yeah, exactly. And when you're watching your hands like move over somebody and you're trying to like really stabilize your energetics of like believing in yourself so that the client can believe in their healing process, like having a little iridescent flash going off on the tips of your fingers is nice.
I haven't gotten my nails done like
So,
this whole time I've been here.
Oh yeah, absolutely. You can wear polish. Of course, there's like a professionalism element of like mine are bad right now, to be honest. And that if I was like meeting new clients, especially, like that could be a little to my disadvantage in some way. But it's not the color that we're worried about. It's the cleanliness and the smoothness of the nails, most of all. Okay. I would absolutely recommend that you keep a little nail care kit in your place of practice, because there's going to be days where you have a little bit of a funny snag on one corner of your thumbnail, or I often get kind of just calluses building at that cuticle edge that will start to kind of fray a little bit, and like you can always just run on yourself and get a sense of like, is this needing a little attention? But just buffing down the calluses and the corners of the nails is really key. And it's all that's super required. When you are working, when you're going into professional mode, the like national level standard of what we're supposed to say is you basically shouldn't wear jewelry and you shouldn't be barefoot. This is Hawaii. And if you are working in a place that allows shoes inside, cool. Like that's good for you. If you choose to do that. I honestly have always worked barefoot, and I just see it as like one of those things where the hygiene of my feet is just as important as the hygiene of my hands, and so I treat them carefully. If you are ever doing any styles of massage that involve working with your feet, which like Thai massage or some different floor approaches might involve that, you're gonna even take that up a few notches and like really treat your feet the same as your hands with the same hand washing protocols and timing and spacing through the day.
For the no jewelry thing, I could get a type of septum that like turns up. Would this count as like,
I would not worry about it.
Don't worry about it?
Yes.
Just don't?
I would say don't worry about it.
Cool.
I wear rings. I take them off while I'm actively practicing. That's all.
Yeah.
Yeah.
Yeah. It's not like
Yeah.
the Victorian era, like showing my ankles,
Exactly.
Like it's there.
Exactly. And being aware of your breath is also pretty important, especially for those of us, which the like LomiLomi style often has a similar conclusion with my style, where you're approaching a person who has already gone into pretty like deep relaxation. They're like opened up, their body's loosened up, and then you're coming in right behind their head and doing this work with them face up, and your mouths are not that far apart. Like, we're far enough past COVID days that like it's at your discretion if you would like to wear a mask. Definitely if you have any kind of symptoms, I would say, like, don't be afraid to stick a mask back on at this point. But on non-mask days, you are going to be recirculating air in a way that we didn't used to be all that aware of. So it's kind of generally recommended we don't have a lot of onions or like a big fish meal like right before going back into treatment. Or I personally, along with my little nail kit, I keep a toothbrush in the drawer of my desk and make sure to just give myself a few extra minutes to tune up, and for myself to be as physically and energetically neutral at the point where I approach my clients. That's going to go through on your bathing products and any scents that you put on your body deliberately. That there are a lot of soaps out there that if you hug somebody later in the day, you're like, oh, you smell so good. Or maybe they don't smell so good, but they definitely smell like their soap. And so you're going to be a little bit cautious about any products that have a strong scent built into them. And so again, that's the kind of rule of thumb, is be as neutral as possible in the sensory experience that you as a human body are creating for the other person's body. Okay. Smoking. This is the standard, to just be very clear. If you smell like smoke, this is problematic for your client. So while it's not my scope of practice to tell anybody to not smoke in a general sense, absolutely do not walk back into the treatment room after just putting out a cigarette at any time. The more space that you can give yourself to clear out, change your clothes, freaking do whatever it takes to not smell like smoke ever in your treatment room. The easy way is don't smoke, obviously. And our sobriety is also pretty important. We're not going to go into the treatment room carrying a disruption in our ability to perceive the client from using alcohol, using cannabis, using any illegal drugs. If you are on prescription drugs that have some cognitive effect, which is not so uncommon, like if you're on prescription drugs with a cognitive effect, that's a whole project to figure out how to get your life to adjust to that. And you can absolutely figure that out. But in the treatment room, ongoingly, we're creating this neutral state. We're trying to figure out how we can be adding as little as possible to the client's need to process. And so if you are, for medication reasons or just for energetic reasons or like life event reasons, if your behavior is difficult for you to regulate, you need to do what it takes to prepare to go into the sessions as cleanly as possible, and you can absolutely get help for that. So whether or not something comes to mind at the moment, Kumo Kekai and I are both ongoingly here. You can look us up and ask us a question at any time in your future career, especially about anything that is like a little more sensitive or fragile or harder to find the information on. So there's always a strategy, a way to work through that.
Thank you.
Yes. Let's see, we've got that. It does want us to address. This book cracks me up sometimes. Okay. It wants us to address your temperature. I feel like you are grown-ups and I don't want to talk about it that much, honestly. But like in the mainland, in the frozen north, you're going to receive a lot more kind of judgment about whether your body is fully covered. Here, our traditional practitioners are wearing like literally a piece of fabric tied onto their bodies. So I feel it's appropriate to give a lot more discretion to what you need to be wearing to stay cool if you're practicing in a warm environment, loose-fitted clothing with decent coverage. And of course, if you're doing any stylistic stuff where you're getting up over the client's body and more exposure is a potential concern. Like, again, I always wear bike shorts. Or actual leggings, you know? So just make it easy on yourself. And this is all what the standardization requirements of like the government's expectation for licensed professionals is kind of breaking this stuff down explicitly. But I expect all of you will easily be able to be sensible and aware of your environment, imagine your client's perspective, and work out all of this stuff for yourself as fairly obvious. Any questions there?
Well, they're going to test us on should you wear shoes and be fully clothed, but we're just going to practice the way we want. But on the test, we're going to understand.
I
Yes, we wear shoes.
haven't seen any questions about whether you specifically have shoes on. I think, yeah. So many things are at professional discretion, and I totally advocate for the highest possible standard for yourself in terms of what you know, what your scope of practice limitations are, what you can offer and what you shouldn't offer, all of those like energetic and dynamic pieces. Like push yourselves and do your very best. And also, like, unlike some other medical professionals, we are not under an expectation to like portray ourselves as superhuman or to look like we have everything together in order to function on a baseline. Like, it's okay to be very human with your clients and invite them into allowing their own humanity to come through into your practice as well.
I've seen the terms on quizzes that I've taken, transference and countertransference a lot. And those definitions always escape me. Is transference like the relationship that you have with the client, and counter is like when they're projecting something onto you?
Okay, let's zoom that up a little bit.
Yeah.
The idea of transference and countertransference are psychological kind of observations about humans' work that all care professionals need to have some awareness of, because our clients often will not, and they will not recognize per se that they're having an experience that's caused by their previous experience. So we just, like, it's stabilizing and grounding for us to stay aware that we're not always getting treated the way that we specifically as individual humans deserve or should be treated, or is just like baseline appropriate. So transference specifically would be when the client uses a mental model that they developed in a different relationship on you. Does that make sense?
Yeah.
So when they're treating you like their mom or their doctor, or maybe a bully. Maybe they're like resisting you in a way that doesn't make sense based on your behavior, or like whatever it is, they've developed these sets of behavior protocols in other relationships. And of course, we're always bringing in our whole past and our whole experience that we've already developed in order to interpret and make sense of new experiences. And so when the client is placing one of their old role frameworks onto you, that'll be transference. And most of the time you'll see countertransference described as essentially when you engage with that as a professional. That if you, for your own personal reasons, get something out of being treated like mom, like that helps you feel needed, or you kind of like you play into the role that they've given you. Sometimes it can look like differing roles, like maybe they're using a network that just somehow you also have a past behavior network that you can turn on, whether or not those actual roles make sense playing together, but you just get pulled into responding to them with a different network of your own as well.
Kate guy was talking about Aka yesterday, like the power of cutting off. So it's not necessarily like a negative. I mean, when they bring it up in the quizzes, it sounds like it has a bit of a negative connotation, like the idea of being really careful with those boundaries. But I guess like if you're able to release and able to walk away, change the energy, then
right.
But those questions are kind of like
yeah. It can be really loaded, definitely. And there is kind of a whole cluster inside of the professional sphere of people who feel like the only appropriate response is avoidance. And like if you can't get them to stop doing that, then you need to not work with them. And probably that's the best choice for those people and where they're at. So, okay. For me, I really specifically feel the call into addressing like the scale of which loneliness is such a fundamental piece of stress and anxiety. Stress and anxiety are such a fundamental piece of the collapse of baseline health in our society, all of these conditions that track back into that. So for me, I actually, as a body worker, aim for a certain threshold of transference. Like I want people to be able to, from a somatic place, have the experience of being held and not being isolated and not being alone, and to be able to build comfort with that. And I work a lot with people who are quite lonely because of like extremes in their attachment approaches, right? And so for people who are generally landing very avoidantly, having a few safe experiences of letting somebody all the way up into your space and being able to engage in some kind of release process can help them set up to open up more effectively. For people who are really swinging to the anxious attachment side, having somebody that they can come to as much as they need to and not worry about getting rejected or abandoned because it's too much, you know, again, can settle their like overreactive tendency. So that's just specific to my practice. And I would say there are lots of different practitioners from whatever different spiritual integration background, or people who are doing structural work that is more intimate for whatever reason. Like there's lots of reasons why high awareness of transference and countertransference is really important, but it's not something that you have to absolutely run away from. It's just something that you stay aware of. And it falls inside of, as you develop your professional approach and the experiential aspect of maintaining your own energetics and staying in your presence, like choosing your own presence and building it the way that you have deliberately established who you want to be, maintaining who you have chosen to be in the moment, moment by moment, will generally eliminate those concerns. Because you're not getting pulled into like artificial past networks very easily if you're really cleanly yourself. Does that make sense?
Yeah. Totally.
Yeah.
Yeah.
Okay. Cool. Let's take a little break at this point. And we can circle back into sanitation after you all have enjoyed a reset.